Detroit police are seeing an overwhelming number of mental health calls, and the city is now looking to make big changes to respond to all of them. There have been 3 major mental health incidents in just the past 2 months. Yesterday, we showed you how Police Chief James White helped talk a barricaded gunman out from a home after a deadly dispute with his neighbor. Last week, Detroit police shot and killed a 27-year-old mother of 2 during a mental health crisis. And on October 2nd, Detroit police shot and killed 20-year-old Porter Burks during a mental health crisis after police say he came at them with a 3-inch knife. The deaths have led to an uproar from Detroiters demanding change, and now a promise from the city and police of a new non-police task force to handle some mental health calls. Tonight, 7 Action News' Sarah Grimmer with an in-depth report analyzing how big of a problem mental health has become in Detroit and how the new task force will work.
Kiyaza Miller, Porter Burks, those aren't just anomalies. They happen all the time.
Alexandria Hughes is a mental health activist in Detroit who has spent the year holding rallies calling for a third-party mental health response team in Detroit.
I've dealt with some of the same issues.
She told me her passion is fueled by close friends who struggle with mental health and feel more triggered when police respond to help.
Not having those resources or knowing where to go or feeling like the resource was the people who harmed my friend is scary. Seeing that every day is very scary.
Psychiatrist at Sinai Grace Hospital and professor at Wayne State University, Dr. Gerald Shiner backs Hughes up.
Mental health care is at a crisis state in our city and across the country.
Dr. Shiner responds to mental health patients at the hospital and says when those patients are having their worst moments, the presence of weapons or intimidating personnel often makes the situation worse.
Patients who experience those kind of difficulties are often frightened and think that everyone else is out to do them harm. Mental health professionals are the best fit personnel to respond to a mental health crisis. Mental health personnel are not available.
With the lack of a mental health response team, Detroit police have been responding to the uptick in mental health calls. According to DPD data, Detroit police officers have responded to more than 4,300 mental health calls this year. Nearly 1,000 of those calls involved violent offenders. What's more, the department is responding to an average of 64 mental health calls per day.
That's a lot. I feel like that's further research to show that we just need more resources for mental health.
That's 64 calls a day is beyond the ability of emergency services to care for in many instances.
Now change may finally be coming. DPD has been partnering with the Detroit Wayne Integrated Crisis Intervention Team for crisis intervention training. But now they're also listening to activists like Hughes and working with Detroit Councilwoman Gabriela Santiago Romero to create a non-police response program to address nonviolent mental health calls.
The reality is that our police have seen an influx of mental health calls since the beginning of the pandemic. 50 to 60% of these calls are non-violence mental health calls, meaning that our already stretched thin police force is using their resources to respond to a call that a mental health care provider or social worker should be addressing.
Santiago Romero says the task force will be similar to Denver's STAR program or Portland's Street Response program. The STAR program deploys emergency medical technicians and behavioral health clinicians to engage people who are experiencing distress related to mental health, poverty, and more.
I think that a straight-up mental health response presents someone who intervenes who's less threatening to a patient and someone who intervenes who's got more experience in dealing with patients in crisis.
Studies following the Denver STAR program found that neighborhoods with it found a 34% decrease in low-level crime. It's promising data and hopefully improvement that Detroit will be able to mirror. Activist Hughes says she'll be watching.
I don't think it's the end-all be-all solution. I think it's the start of what we should have.
Sarah Grimmer, 7 Action News.